Hello, everyone. Welcome to today's webinar brought to you by the Leadership Development Group. I'm Jess Molson, TLD Group's Director of Client Solutions. Just a few quick notes before we get started. Please note that all attendees are automatically on mute for the duration of the webinar. We will be taking questions throughout today's session. Please feel free to submit your queries through the questions box on your GoToWebinar control panel, and our presenters will respond to them throughout the presentation. Additionally, please note that this presentation is being recorded. We will provide a link to the recording to all attendees. We appreciate your attendance and hope you enjoy the event. I will now turn it over to my colleague, Tara Satlow, Vice President of Client Solutions for the Leadership Development Group, for a brief introduction of today's presenters.
Thank you, Jess, and thank you everyone for being here today. As many of you know, the Leadership Development Group, or TLD Group, is a life cycle talent development firm that focuses on developing leaders to execute organizational strategy. We believe that leaders play a critical role in advancing conversations around equity, diversity, and inclusion from awareness to action. Leaders have the platform and influence to ignite the dialogue that leads to meaningful change. Today, I'm honored to introduce you to someone who has dedicated his leadership platform to doing just that. Dr. Ronald L. Copeland currently serves as Senior Vice President of National Diversity and Inclusion Strategy and Policy and Chief Equity, Inclusion, and Diversity Officer for Kaiser Permanente. In his role, he leads Kaiser Permanente's efforts to ensure strategic vision for equity, inclusion, and diversity is successfully implemented to drive strategic business and mission outcomes. Kaiser Permanente embraces the belief that life, liberty, and the pursuit of happiness require total health. That includes equal access to high-quality healthcare for all, regardless of who they are or where they live. As an organization, they recognize the strategic importance of building an inclusive and equitable organizational culture and the central role this plays in overall success. Their commitment to equity, diversity, and inclusion manifests itself in many important successes, including Kaiser Permanente's 39 hospitals being recognized as leaders in LGBTQ healthcare equality for 10 consecutive years, the 2019 launch of Food for Life, Kaiser Permanente's landmark National Food Security Initiative, which takes a comprehensive approach to transforming food-related economic, social, and policy environments so people across the nation can access and afford healthy food. And the launch of Thrive Local, Kaiser Permanente's innovative new social health network designed to address pressing social needs by giving healthcare teams and providers instant access to a directory of social services agencies, allowing them to make referrals to community organizations and track those referrals to confirm that a member's needs have been met. Today's session will be facilitated by TLD Group Advisory Board Chair, Dr. Bob Sachs. Prior to his work with TLD Group, Bob spent 19 years at Kaiser Permanente himself, most recently as Vice President of National Learning and Development. So now, without further ado and with distinct pleasure, I turn the mic over to Bob. Bob?
Thank you, Tara, and good morning, everybody. And Ron, great to see you. We had a lot of opportunities to work together, and it's great to be able to have this conversation with you today.
Thank you, Bob. It's a pleasure to be here, and I truly appreciate the invitation.
Great. So, this is such an unusual time in our country. We've got a pandemic coming on. We've got national elections coming up very quickly. We've got huge discussions going on in the country around issues of racism, social equity, and justice, all critical topics in and of themselves, and here we are facing these all together. And of course, Kaiser Permanente has a long history of focus on affordable, high-quality health care for everybody, a focus on being sure that all have access to care, and a commitment to diversity and inclusion that goes back from the founding of the organization. So this is a perfect time to be talking with you, and why don't we just get into the conversation. So where I'd really like to start is, given the brief introduction I just made, how would you describe KP's view of the impact of racial disparities and social determinants on the health of the communities in our country.
Well, thanks, Bob. Well, as you heard in some of the introductory comments about our longstanding commitment to diversity, equity, and inclusion, that commitment is really born from a couple of recognitions that our founders identified early in our 75-year history and evolution. One was the tremendous power and benefit of having your workforce at all levels, C-suite, managers, individual contributors, physicians, and so forth, reflecting the diverse makeup of the communities that you serve. We found that provides ambassadorship, insight, allows us to build trust and to really understand people's day-to-day lived experience as an impact on their health. And so that's been a long-standing commitment, and we've over our history learned the value and role of culture and language alignment in providing effective communication. We understood that disparities are out there, they're real, and we made a commitment to identify and eliminate those barriers wherever possible. In more recent times, we've expanded our orientation to understand that the social needs of people, that you heard some of those in the introduction about our focus on access to nutrition, making healthcare actually affordable and accessible in ways that are meaningful to people. And this notion of total health helps us really understand and appreciate that people's day-to-day lived experience has more impact on their health status than the few minutes they may spend with us in an office visit or in our emergency rooms. And I think the current times, the complexity and the doubling down that you described has just heightened our awareness to go to another level to understand that part of that lived experience is the impact of systemic racism, the impact of different forms of oppression and disadvantage that people are saddled with from a structural standpoint. So if we're really serious about improving the health of the communities that we serve, which is part of our core mission statement, we're very clear and would ask others to reflect on it as well, that we have to expand the boundaries of our influence and impact to include taking on those social need issues as well in order to create an environment where people can actually have true health.
Great, Ron. And in doing that and focusing particularly on these broader factors that impact the health of individuals and of communities, there are lots of organizations. Kaiser Permanente is one great organization with a focus on providing high-level quality care and affordable care. But with this broader mission, there's so many other factors that drive that. What other key stakeholders does Kaiser Permanente look at when they begin to think about the ecosystem of that is necessary to create the kind of healthy communities that we're striving for?
Well, I think beyond the walls of health systems, healthcare and coverage systems, regarding the environment, we have to start at the beginning. We have to start with people's home life and what risk factors they're exposed to that might create additional or exceptional vulnerability for them in their day-to-day living. So we see that, for example, manifested in the COVID-19 experience, where individuals who live in communities where housing is very expensive, and so there's a tendency for multiple generations to live together under one roof. That has economic value on a day-to-day basis, but under these COVID-19 experiences, that heightens people's ability to get exposure to the virus and to have a higher exposure rate and therefore a higher infection rate, which is obviously not something that we want. So something as basic as physical distancing can be a challenge based on the housing arrangement that a family has, based on socioeconomics, based on cost of living, and so on. So we have, in our day-to-day work, we pay attention to the lived experience, we pay attention to the educational experience, and the alignment and access to nutrition, the exposure to violence, the policy world that drives budgets, drives access to resources, and so forth. So all of those areas are kind of the ecosystem that our patients are in the center of, and we've just believed that we have to be increasingly accountable for those spaces and identify that that is part of healthcare and health improvement as well, as opposed to the traditional bricks and mortar boundaries that say when you come into our offices, that's when our job begins, and when you leave, our job is over. That's something that we do not subscribe to, and are using our resources and our commitment to try to have a bigger influence and model what's possible.
Great, and I want to talk about that in a minute, but before we get to how KP is really focusing some of its resources, is there a vision of the future that KP uses to inspire its action when you think about the world that you would like to see, and what people will be experiencing going forward when all the systems are working together? What does that vision look like?
Well, certainly it's a vision that is evolving, but it's a vision that certainly includes universal access and coverage for all people. We believe that that is a right, not a privilege, that people should have that basic access to care and coverage in a way that we've described. And we believe that people's aspiration in their lived life is to achieve their dreams. Everyone has dreams about what they want to accomplish in their life or for their family. And that to do that, you have to have good health. So our vision is that we create a system across this great country where people have the access and the coverage needed, so that when critical illness occurs, people's savings, their economic status is not tremendously vanished or diminished because of crisis management for health. There are many ways to achieve that, but that's certainly something we aspire to. And we believe that as it relates to talent development and people being able to innovate and create great things for the world to benefit from, these critical needs have to be taken care of on a pretty consistent basis to free up the energy and the attention for innovation and creativity. And so that's our aspiration, and that would include, under the current circumstances, the elimination of all measurable and impactful disparities on people's life in terms of their healthcare conditions. Some disparities are related to barriers or occurrences that are not particularly amenable to interruption, but the vast majority are. And so our goal and vision is to, at a system level, identify them and eliminate them to achieve the objectives that we're describing.
Great. So given that vision, how has that shaped the way that Kaiser Permanente has thought about both care delivery and the investments it chooses to make in the communities that it serves?
Well, I think if in the care delivery, our orientation increasingly going forward is around health equity and understanding that any barriers that are unjust and preventable that should be eliminated. And that's what health equity is leveling that playing field in terms of opportunity and care and outcomes. And in order to do that, you have to have, we believe, a systematic approach to that effort. So one of the initiatives that we have launched several years ago was to take the Institute of Medicine 6 aims for healthcare of the future, and one of which is equitable care, and embed those 6 aims into our quality improvement apparatus as core dimensions of quality that we hold ourselves accountable for identifying, for measuring, for gaps, and when we find gaps, to close those gaps, so that it is not a standalone activity. It is now in part of our quality improvement process. So the rigor that quality improvement has in almost every health system, the resources that are given to it, the transparency, the accountability to drive results, the accreditation standards that are behind those expectations, and the measurements that the country holds us accountable to, those now for KP includes equitable care. And so we're forming a set of learning a journey for people to understand equitable care, what it means, building the analytic support to assess our data, disaggregate it to see opportunities, and then to create communities of practice inside and outside of our organization. What are the best practices to eliminate those disparity gaps, however they fall, however they break out in terms of different demographic categories of diversity. And so I think building it into the fabric of quality gives it a long-standing place of legitimacy, resources, and impact. And then we also have been on a journey with community-facing activities, not to just acknowledge the role of social needs such as housing and accessibility to nutrition and care and coverage, but to invest our dollars and partner with community organizations across the board to make that a day-to-day living reality for the people that we serve. As you know, our mission statement talks about improving the health of the communities we serve. So that's not just limited to the the millions of people we take care of across this country. It also includes all the community and people who are members of the communities in our geographic footprint across the country. So Kaiser Permanente member or not, we feel we have an obligation and core to our mission to improve the health of all the communities where we operate.
So can you give folks a little bit of a sense of, a couple of the investments that KP has made to make that commitment real?
Yeah, for example, we've invested over the past year or two, multi-millions of dollars in collaborations with city organizations to take on the issue of homelessness. And part of that is the ability to identify people who are in homeless scenarios, understand the drivers of that scenario for them, and then to create new avenues for them to become housed, if you will. And the other side of that is investments and partners with health organizations, with community organizations to build affordable housing and to be innovative in the communities so that people are not just put in temporary housing, but create opportunities for them to be permanently housed and brought off the streets. We've also made tremendous investments in making food and nutrition available to people. We have a tremendous supplier diversity program that focuses a major part of our investments on making sure women and minority-owned small business are getting their fair share of our supplier product dollars and tracking that. And today, Kaiser Permanente was the first and is only healthcare delivery system that has been appointed a member of the $1 Billion Roundtable because of an ongoing commitment to make sure that small businesses and particularly minority-owned small businesses are getting their fair share so they can become economic engines in our communities. And if they're able to do that, they're going to hire more people to provide jobs. They're going to be able to invest in the health of the community. And that's a virtuous cycle that we know is really critical to delivering on the goals and vision that we have. Many more examples, but those are just a handful I would point out to show the breadth of the social needs as well as the commitments we make in the healthcare delivery space as well.
Yeah, and one commitment that I know KP made, and I'm just bringing it up because I just read just this week that Kaiser Permanente is the first healthcare system in the country to go carbon neutral. And that was a many-year journey, but given the fires that we're having in the Western United States, being carbon neutral is a pretty big contributor to the health of a community.
Absolutely. And again, I think that's an award that we treasure very much, given all the work that's gone into it. But again, I think the most important thing about that achievement is it demonstrates what's possible with leadership, with dedication of resources and focus and collaboration with many other stakeholders who share that state of mind. And the fact that we made those investments as a healthcare and health system demonstrates, again, that we see the contributors to people's health broader than just the healthcare that happens within the walls of our facilities.
Yeah, and so, these are big investments, and there are a lot of things that compete for dollars when you're sitting around the leadership table trying to determine what long-term investments to make. Can you give us a sense of what the conversations are like at the leadership table, at the board level, that precede the decision to make some of these significant investments?
Well, there's from a supply and demand standpoint, we know there's always more need than what we could cover as a single organization. And so part of those conversations is what will we launch ourselves and what will we do in the name of collaboration and partnership with others? And wherever we want to scale things at across the country at a bigger level across communities. We know that even as a large and long-standing system as Kaiser Permanente is, even we can't do a lot of these things on our own. We have to collaborate and partner. So our conversations inside the organization are informed first and foremost by talking to our stakeholders. So we talk with mayors, and we talk with business people, we talk with our patients, we talk with advocacy organizations to get an understanding from a needs assessment standpoint of what are the things that are most important to you that are lacking and that have a detrimental impact on your health status. And so when we collect all that information, we then look at where's the biggest impact, what can we do with our dollars and our knowledge and our voice, where can we have the most sustainable impact from a scalability standpoint and from a time sensitivity standpoint. So my point in that is that we don't just randomly sit around a table having conversations and whoever's voice is the loudest prevails. These are thought through in the same way we think about our business strategy and our quality improvement strategy in healthcare. It is data-based, it is informed by multiple conversations. And then we identify a set of high priorities that we could go in the direction of and build a portfolio that allows us to impact the social needs, to impact care, investments in technology that will enable and bring more care to people, and some of the policy areas that will also make care more accessible and affordable based on the current status of healthcare coverage in the country. And so there are the dialogues and the debates, but in aligning our mission and wanting to build a broad portfolio, it's relatively easy for us to come to conclusions about where we want to have our impact. And to the best of our ability, we try not to put all of our focus in one or two areas. We tend to spread it. So most of what we've learned from our communities about what's important and essential fits within the portfolio, and we continue to build on that.
You know, one of the things that is so important, and I've had the opportunity, I see Tara's popped in, which means we might have a question. So I'm going to pause my questions and see what the folks listening in are interested in hearing about.
Great, thanks, Bob. So I have a couple of quick questions and some that are a little longer. First, just for clarification, the question is Kaiser part of Healthcare Anchor Network?
Say that again.
Is Kaiser part of Healthcare Anchor Network?
I'm not familiar with that particular term, anchor network. So I can't say we are or aren't. There may be part of our organization, community health function, that may have specific partnerships with that organization. But that's not a term I'm particularly familiar with.
Okay. Next question. Can someone give me the exact IOM, 6 Health Equity Aims, Ron referenced?
Yeah, it's patient-centered, efficiency, effectiveness, safety, equitable, and timely.
Well done. And then finally,
that was a test, Ron. That was great.
I was going to say, that was excellent. What challenges does KP face currently in creating and nurturing a sense of inclusion and belonging internally amongst its own staff? And how are you trying to address these?
That's a great question. And I think a couple of things I would say that first and foremost, as we all sat around the leadership table regarding the current situation with COVID, the racial injustice that we're witnessing across our country, our CEO, Greg Adams, was very clear and was strongly supported by all the folks around the table that we have to use this opportunity to recommit ourselves to our values and our influence and impact in the name of health equity and eliminating barriers of racism and oppression in healthcare. And that to do that and to lead in that space, there were external activities that we would do, investments and raising our voice and in solidarity with others. But he also was very clear that we can't be credible leaders externally unless we got our own house in order. And so we have several key initiatives specifically related to building an inclusive culture with giving people both the knowledge and the skills to, on a day-to-day team level basis across the expanse of our organization, to mitigate bias and discrimination, to lead with an inclusive orientation that creates psychological safety so that allyship can be activated in people who witness or see microaggressions or unconscious bias at play, have the ability and the language that we've agreed on to call that out without fear of reprisal, and a continuous learning organization going forward. So we're making, we have a big project called Belong at KP that we're developing the deployment plan for now that will reach across the entire expanse of Kaiser Permanente, both med group and the health plan, to take us on a learning journey over the next 2 years to really give us core ability as opposed to just aspiration and awareness on how to mitigate bias. And we also are very clear that we will leverage and use our voice to also address and make sure that we understand the role that systemic racism and oppression can play in disrupting health, and not just be aware of it, but ask ourselves, how can we be accountable inside our organization and externally to address that in a way that aligns with our whole framework around social needs and health improvement in general.
And does KP offer a diversity mentoring program?
Well, we have mentoring programs across the board for a variety of reasons. We have employee resource groups, which are affinity groups within our organization based on a variety of demographic identifying categories that people rally around. And as a result of people's participation in those programs, we have assigned senior executive sponsors of those groups that provide sponsorship and mentorship across the board. And that's something we're also looking at on about how we get more effective with that. One of the important things we did during this crisis was to have listening sessions with all of our business resource groups to understand and hear what is their day-to-day lived experience like? What is it like leading these roles? What is it like in terms of career development opportunities and witnessing or experiencing any forms of bias or discrimination? And help us understand, several layers deep into the organization or away from the C-suite, what's actually going on and where are the opportunities. And so we've been very informed and moved by the stories that our employees have shared with us. And are now working on what are going to be the interventions and solutions we take on to address the issue that they brought up. So it's been a very powerful and moving and really critical time for us to understand through the voices of those that we choose to serve and are here to support to recalibrate our efforts going forward.
Okay. And Bob, okay, if I ask one more and then I'll exit for a bit and come back. Okay, so last question. Can you describe how far along KP is on your journey to embed equity into your QI apparatus?
Yeah, great question. So we've had a long-standing journey in the space of understanding and deploying culturally competent care and language proficiency to understand how important communication and building trust is. And then we went on a learning journey over the last 15, 20 years, specifically identifying disparities that broke out based on racial and language demographic identities, and identified gaps and put together communities of practice to demonstrate we could close those gaps. But the health equity conversation now is the next kind of frontier for us, where we identified not just the things that we've already built foundational, but understand the social needs, disruption, and the role of oppression and racism individually or at a system level as part of the next aspect of our journey. So we have made equity a dimension of quality. That's one dimension of where we are. And as we speak, I have a meeting later today with a cross-sector, cross-functional group of our leaders from community health, from the medical groups, from our quality improvement apparatus, and from the equity, inclusion, and diversity function to talk about creating a health equity advisory group, a senior advisory group that is a wraparound to our infrastructure for quality improvement, because quality improvement is where the work gets done. That's where it should get done, but it needs to be informed and a framework created to help us be accountable in that space the way we are for all the other aims of the Institute of Medicine and our quality improvement as general. So I expect this council to be formed and our work in a more formal way to be launched in the first quarter of 2021.
Great, thank you.
Okay, see you soon again, Tara. So Ron, since we've just had this conversation about some of these actions that KP has taken around health equity, seems like an appropriate time to perhaps bring up the new Kaiser Permanente Bernard J. Tyson School of Medicine that just opened its doors this year. You're a member of the board there. Perhaps you could tell folks a little bit about, first of all, why KP took on this significant endeavor, and also how it relates to the issue of culturally competent care, health equity, and making sure that everybody gets the best care possible.
Thank you. Well, I say the School of Medicine, as you noted, just opened recently, and our first class has 50 students in it. Our first 4 classes are scheduled to have 50 students in them. Our aims for creating the school is to recognize a couple of things. One, if we're going to really, as health industry, advance the work and really get serious about health equity, we know a critical element of health equity is representation of the communities we serve. And as we all are aware, and the data is very clear, if you look at the demographic makeup of the country and the patients that we're all serving, and you look at the demographic makeup of physicians and medical educators, it's a story that says that exclusion historically is still causing harm to us, and we've not arrived. So one of our aims with the school is to be part of a new vanguard of medical schools that will make sure that the composition and the representation of our communities is reflected in the body of students that are going to be the next generation of physicians that we bring forth. So that's been a very important pillar in our efforts. But as important as that is, probably more importantly, is to understand everything we've learned about the role of culture and language, the role of picking out issues of disparities, the ability to understand system science and how you can impact at scale and more sustainable impact working through systems than just individual activities. System science, understanding an integrated model and giving students a chance at their formative years to really understand how all these constructs are integrated in the context of medical education, their curriculum, and their day-to-day experience. Our aspiration was to take everything we've learned over our 75-year history, integrate that into a medical education program and curriculum, and then attract students who see that and want to be part of that as part of their future aspiration. And so the investment in the school and the fact that Permanente physicians are core and critical to the clinical education of our students, so that they not only see it and talk about it, they actually are taught it and witness it in day-to-day operations to see how integration actually works, how systems actually work. And then the other component of this, there's a new breed of medical schools that are also kind of dismantling the traditional way of doing medical education, leveraging much more technology and innovation, integrating the clinical years right at the beginning with the medical science years and so on, which is very different than the way I trained, years ago, where the sciences were done first and you really didn't get a chance to interact and monitor patients until your 3rd year. That's all done really from day one in this new curriculum. So all those factors are really part of our desire to be part of a new vanguard, lead, and be a transformative agent in the way medical education is accomplished and who is educated, given the opportunities for the future.
Yeah, and I think when we spoke the last time, while one objective obviously is to provide some kind of a pipeline of new Permanente physicians, you've also got a commitment to bring people in who aren't necessarily going to follow that path. Could you speak a little bit to that?
Well, I think one of the questions that a lot of people asked us about when we were in the formative stages of the plan was, is this just Kaiser Permanente creating its own medical school to be a pipeline to Permanente physicians in the future? And our answer, resounding answer to that is absolutely not. Our true aspirations is that through this experience with Permanente physicians and their ability to understand how integrated systems work, our aspiration is that these individuals will not just be excellent physicians, but they will be champions for health equity. They'll be champions for integrated care, and that they will be leaders who can go back to their respective hometowns, communities, and help develop and implement, deploy systems similar to the types that they've learned about in the future, because our bias and belief is that systems, integrated systems, do a better job managing populations than fragmented systems, as many people get their healthcare from today. And so while they're getting education from permanent day physicians, and certainly if an individual does his or her residency and decides I would like to work within the Kaiser Permanente system, there's nothing barring that, but that's not an obligation. This is not a pipeline into our system. This is a pipeline to the broader medical field and profession to make sure we have leaders who have gotten the opportunity to learn about this in their formative years and then can continue to build these systems outside of Kaiser Permanente's walls, if you will.
Great. So, we've already talked about a lot of significant investments that Kaiser Permanente has made, and there are many that we haven't talked about. What has KP done? And you talked about the conversations around the leadership table. What is it that allows KP to attract leaders with this kind of a mindset, and what is it that creates the alignment necessary in a very large organization that not only includes an insurance health plan, a hospital system, but also a set of independent Permanente medical groups that have been partnering exclusively with the Kaiser Foundation Health Plan for years? What is it that creates the ability of the organization to work together in the way that it does?
Well, when we ask each other that question internally, the resounding response is the mission. The mission of Kaiser Permanente to provide high quality. So people who are health professionals providing care want to be in an environment and an organization and culture that really puts a high premium on quality. Because they want to do the best for their patients and the communities they serve. They want to see data that tells them people are actually improving their health and getting better. So the fact that Kaiser Permanente has anchored that in its statement and in his actions, so it's not words, it's also in his actions and his investments. That's a credible understanding that quality in the way we define it is an important construct. And that there's an orientation around serving people and bringing folks together who, from a life's commitment standpoint, want to be in a position to serve others and improve lives of others. And the testimony of that is when you look at what many of our employees, physician and non-physician, do outside of the organization on their private time, the volunteerism that people are involved with in the local communities and even in other countries never ceases to amaze us. And every year we celebrate and recognize people who do tremendous things in their personal time, again, to help understand the kind of people we attract and retain in our organization. But the other part of it is when you bring a model together where you have the business people of a health plan and the clinical people of a care delivery model, there's got to be agreement and understanding and appreciation for the strengths and the knowledge and competencies that each brings to the table. And so I think that the thing that makes this model work is how we do decision-making shared and respective of the oversight that physicians have of physicians. So we understand physicians should be led by physicians. We understand that the care delivery model has unique requirements and culture and rhythm that is aligned with but different than the business mode that a health plan operates. And so decisions and the apparatus that we have built for shared conversations, for joint decision-making where it makes sense and where it's required to get us all aligned, that is the culture that has been part of this organization since its foundation, because it was a pioneering physician, Sidney Garfield and Henry Kaiser, the industrialist, that formed this organization. So they had their battles around who was going to be in charge, and the resolution they came to of this collaborative approach and a shared vision of what is possible, that is core to this organization as well. And so that's not something you can put on automatic pilot. That's something you have to have ongoing management of the tension that's always there in terms of decision-making, resources, et cetera. But what it also requires is enlightened and inclusive leaders who understand and respect difference, are not afraid of dissenting opinions, and hear different views, and the best ideas prevail as we go forward. So if people feel that their voices are heard, that their knowledge and wisdom is respected, and it's considered at the time the decisions are being made, even if the decision made is not the one that one group or another might have asked for, they can appreciate that their voice was heard and agree to support the common benefit that we go forward with. And then, of course, there are those decisions that health plan makes every day on their side of the organization, relatively without a lot of need for consultation, and the same for the medical groups on the things that matter in clinical care. So it takes time and attention. It sometimes slows us down in our decision making, but what we learn is when we do that and get the buy-in, then when we're ready to go, we go fast and we're able to scale at a very appreciable rate.
Yeah, and then as you said, I think the unifying thing is that everybody understands the mission and purpose of Kaiser Permanente. That's why they're working there. And one of the things that I recall when I was there is I could talk to anybody in the organization at any level, and they could tell me word for word what Kaiser Permanente's mission statement was. So that's a pretty powerful thing that I'm sure helps conversations. And it looks like Tara has come back.
Yes, here I am with a few more questions. So this first question is a two-part question, and that is the first part: do community healthcare systems have the resources to invest in the social determinants, or is it feasible only in the large vertically integrated systems like Kaiser?
Well, I think, when you say community service organizations, if you've seen one, you've seen one. And my point there is that there's tremendous variability in their capacity to execute on the missions that they have. So their voice, regardless of size, is always important, and that should be listened to. And when you agree that you're going to try to take down some barrier in the community in the name of improving health, that's where resources and collaboration have to come together. And so I think if the community service organizations are dealing with health systems, businesses in a collaborative effort, and they bring different strengths to the table, and those are honored and respected, then I think the size is not as much a barrier as if that were trying to be done. If an organization were trying to do that on their own. But they're highly variable in size and scale. And at Kaiser Permanente, our community health function works with organizations of all different sizes and scales.
Okay, great. You actually addressed the second part of the question. So I have another question for you, and that is D&I connected to KP's Total Rewards and Recognition Program? And if so, how?
Well, I think when we talk about quality improvement, or we talk about our engagement levels of our workforce satisfaction, patient satisfaction, and so on. These are all things that are really critical for us in our organization. So when we think about rewards, when we think about incentives and alignment with our values and mission, these are things that we measure, and these are things that we increasingly hold ourselves, leaders and managers, accountable for delivering on. So from a total reward standpoint, for example, the disparities work that we did over the last 15, 20 years, over a period of 10 or 15 of those years, each of our leaders of our respective business markets and all of our clinical leaders all had goals to achieve in that space. And that was part of the system. But those financial rewards and those approaches all came later in the process. The first process was, can we get the work done? Do we have the right resources? And then let's look at our data, let's improve our practices. And when those things were done and people have confidence, then we incorporate those things into our reward system because they become strategic priorities, and all of our strategic priorities are part of that system, if you will.
Okay, next question. It is controversial in Canada to be a physician leader and not continue clinical practice, which is limited to one specialty and has finite system learning in this question poser's opinion. What is the model of KP for physician leaders and continuing clinical practice?
Yeah, two answers I would give to that. One is kind of a formal and one is more cultural. So I am, as I said in my opening remarks, I've been with Kaiser Permanente 32 years. The first 25 of those years was as a practicing Permanente physician. And of those 25 years, I was 15 of those 25 years, I was an executive medical director role, which is a senior leadership role for each of our medical groups. But during that period of time, I continued my practice for most of those years. I'm a general surgeon by training, so obviously if you take on more administrative responsibilities and time-consuming activities, your ability to practice a business, a specialty like surgery gets diminished. And so our group model that we practice as a group creates some facilitation for physicians to still stay clinically active and increasingly take on administrative and leadership roles. It's important, and I would say even essential in our medical groups, that physicians lead physicians. And so that's a core pillar of our culture and belief and values, and we make that happen. So our boards of directors of our medical groups understand when physicians take on the full administrative responsibilities of an executive medical director role, for example, they value that enough that they allow for a reduction or in some cases a complete elimination of clinical practice. The challenges for each individual, as I had to go through, is decide if you're given those opportunities for leadership development, when are you ready to walk away from your clinical practice, even on a part-time basis or on a full-time basis? And so each individual has to make that decision for themselves, but it's facilitated and understood that you have to stay clinically active. And the thing about physician culture, and I think this is whether you're talking about the United States, Canada, or any other place, is the white coat is important because that's identity for physicians. And so the challenge that physicians who move full-time into executive leadership roles is, are you still loyal to patient care? Are you still focused? Is the business more important than the care? And I think you have to make sure you're clear in your communication and your actions and in your advocacy that no, the patient well-being and the care of our physicians to provide care and services is still the highest value and service that we can provide to people. But it can be tricky navigation depending on the model and the culture of the organization. And it's only been in this last 7 years that I've been in this particular role, where in our organization, I moved from the medical group side to the health plan side. So now I'm full-time in the executive leadership role, and I'm no longer practicing as a physician. So Kaiser Permanente's model is such that you can stay completely in clinical practice your entire career if that's your desire. You can move into part-time management as a chief of a department, chief of a medical area, medical facility, or advance into the executive realm and spend more time in that space, or completely transfer into a health plan role where you're taking everything you know and understand about care delivery and physician culture to help us, as we talked about earlier with Bob, bridge the gaps and integrate the way we approach and get on the same page to do very important work.
Yeah, and just let me just amplify one point, Ron. You know, you mentioned about the boards of the medical groups, understanding the tension there, and I think it's important to point out that those boards are made up of practicing physicians by and large.
Absolutely, it's important to point out in our Kaiser Permanente model, the physicians are professionals and hired by their respective medical groups and governed by their boards of directors. It's not a staff model where the physicians are employees of the health plan. That's not the model that Kaiser Permanente has.
Great. That's it for the questions for now.
Okay, thanks, Tara. So one of the things that I wanted to mention and get your take on is Kaiser Permanente has been recognized as having one of the most diverse board of directors and one of the most diverse leadership teams, senior leadership teams of any large organization in the United States. How does that happen?
It happens with one word: intention. It's got to be intentional. As I said, from our founding years, we've learned and understood, and more importantly, appreciated the value of diverse voices and perspectives around the table. And diverse voices are in part informed by diverse lived experiences. And so people who come from different cultures, different identities, different professions, cognitively, socially, ethnically, and so on, all of those provide a rich dimension, multi-dimensions of diverse thinking, diverse perspectives on any problem that you put on the table. And so we make a big deal of inclusive leadership in our organization to embrace value and being intentional and creating diverse workforce, diverse decision-making bodies, and so forth, because you want the broadest level of experience and diverse perspectives on the table, and you're being intentional with that. And then that's based on values and observation. There's also been tons and tons of research done by many organizations to demonstrate that highly diverse teams outperform more monolithic teams on a pretty consistent basis when it relates to driving innovation and complex problem solving. So it is beneficial for us in terms of our business strategy and caliber of decision making because it's leveraged that way. It gives us a very important optics so that we're as diverse at the top of the organization, the very top, as we are on the front lines, and our patients and communities see that as well and understand that. And what we ultimately benefit from with that type of representation is we have external ambassadors who are parts of our communities that we serve and help share insights about communities as we're building plans and strategies and so forth. And then inside, there are also advisors to help us understand how we customize where customization is necessary and how those diverse perspectives need to be accounted for in the way we think about how we design our services and actually deploy them. So it's a win-win scenario, but I think one of the challenges with why so much in healthcare this has not been the case is because either the will or the intentionality has not been present to make it happen. And it's certainly not based on a lack of availability of people to serve in these very important capacities. It's just a matter of valuing that and being intentional on how you compose those groups.
Yeah, and clearly part of this has got to be how Kaiser Permanente thinks about developing its talent and moving people forward. Most of the CEOs of the organization have been internal, and certainly Bernard Tyson, the former chairman and CEO, started his career essentially at Kaiser Permanente and rose to become chairman and CEO. And Greg Adams didn't quite start his career there, but he did start several levels down from where he is now as chairman and CEO. So how does Kaiser go about ensuring that it's identifying this talent, developing the talent, and giving them the opportunities to take on greater responsibility?
Well, I think we've always had it, to my earlier points, as an expectation and an encouragement to be intentional. But I think we've gone a level further now because we value its importance so much, is to make sure that we are on an ongoing basis evaluating and measuring and assessing what our pipelines look like from a talent standpoint, again, in many, many dimensions. And so just as in the care delivery space, looking for any opportunity to close disparity gaps based on what we measured and understood, we are now applying that and looking at that lens as well for our workforce as we look at pipeline development and leadership development, starting at our front lines and who is moving into middle manager roles and middle managers being advanced to executive roles, and the development of folks through experience and conscious learning and sponsorship readiness to move into these roles whenever the vacancies occur. And to your earlier point about longevity with your organization, one of the challenges with that sometimes in our organization is because people stay for a long time, many of these leadership roles don't turn over very rapidly. And so sometimes the challenge is retaining highly talented people who may get impatient for their opportunity to move to the next level because the incumbents are there for a long period of time. But we know that there are opportunities to do more and get more effective in creating not just opportunities, but actually capitalizing on the opportunities to make sure the next generation of leaders at Kaiser Permanente, again, continues to keep pace with the diverse makeup in all its dimensions of the communities that we're serving. It's a very powerful signal to the communities that they matter and they see themselves reflected in the physicians and the nurses and the leaders, and at the same time that those perspectives and voices are around our decision-making table.
Great. So we're getting close to the end, and so I'm going to kind of move the lens back up a bit because we've kind of now gotten into a dive into some of the things that make Kaiser Permanente work. And I'm going to give you a magic wand, and I'm going to tell you that with your magic wand, you can proclaim what changes you would like to see that you believe will most improve health equity in the U.S.? What would you do with your magic wand?
Oh, wow, great question. I think at least a couple of things that occurred to me would be one, that the entire healthcare industry system would make health equity a formal dimension of quality improvement. Because I think where it doesn't enjoy that type of visibility and strategic importance, many times it suffers from the lack of data, investments, and people's attention and juggling priorities and so forth. So if it is made a formal dimension of quality and treated with the same rigor, it gets visibility, it gets transparency, it gets supported, and people are increasingly held accountable for getting those results. So that would be one thing to consider. And I would say similarly for health systems who are all have to undergo some form of accreditation, if they were all if the accreditation criteria and evaluations included a framework and a set of expectations or requirements in the health equity space, I think that would also encourage people to pay more attention and collaborate with others, identify effective practices, and actually invest and deploy those to get better outcomes. And I think it also would create more of a scalable community of practice across the country and landscape for improvements. And then maybe finally, that everyone from an aspirational standpoint, a personal agenda standpoint, would really embrace this notion that for people to truly be healthy, that equity and inclusion are core essential ingredients for that. And so if we're really serious about it, I would want people to activate themselves as allies, lead where they stand to make changes, and to make this a more formal opportunity so that healthcare and health profession can really live up to the expectations. After all, we are a community of healers, and people are suffering in numerous ways now, perhaps more than they ever have. And they look to us not only to be excellent practitioners of health, but as champions of social justice and healing and doing the right thing. And so the ethical elements of this and our calling that brought us into this profession, I think if we can all step into that and live into that and lead where we stand, we're going to have a lot more opportunity for success and make meaningful change for a lot more people's lives.
That's a wonderful aspiration. What do you think we need to do to make that real? What's the biggest thing that stands in the way of making that real?
I would say courageous leadership, the ability to make personal sacrifice, to call out things that are wrong in the name of what is better and what will benefit people, and be prepared to do that. And we know that's not an easy thing to do in many circumstances. So the hesitancy to do it, the reluctance is understandable, but in my humble opinion, it's not acceptable if we want to achieve that grand vision.
Mm-hmm. So what advice do you give leaders and organizations in terms of how to move forward on this journey?
Well, you have to first and foremost make up your mind. It's a journey that you are prepared to take, that you want to take. Again, being intentional, gather up like-minded individuals to be part of that group so that it is not an isolated individual act, but you're part of a growing community that can be there to reinforce, to advise, to support, and be bold and courageous in your vision, and be disruptive intentionally with the idea that what we can create collectively going forward will be better for us than what we currently have.
Great. Tara, you're back.
I am back. I am back, sadly, to say that we are at the very end, and that's all the time that we have. So I want to thank you again, Bob and Ron, for being here today and for your willingness to tackle such an important conversation for the future of healthcare. And thank you to all of you for joining us as well. A few quick notes before we let you go. At the Leadership Development Group, we're committed to continuing these important conversations and driving equity, diversity, and inclusion across healthcare and beyond. For more information on how best to move your organization forward in your journey toward creating a more equitable, diverse, and inclusive workforce, please be on the lookout for the link to our ED&I resources, which will be included in our follow-up survey email immediately after this webinar. So thank you both again for taking the time. It was an incredibly valuable conversation. Thank you.
Great. Thank you. And thank you, Ron.
Thank you for the opportunity. It's been great. Take care, everyone.
Thank you.
Bye-bye.